I appreciate you allowing me to be here today. My name is Cristy Long, and I'm a clinical educator from Rockingham Memorial Hospital. Rockingham Memorial is developing a new program, which is going to be a certified stroke unit. And with that, we would like to come out and educate the community on the different symptoms and risk factors and different things about stroke. So I'm going to do a short presentation for you, and then I will be glad to open up and answer questions for you. The new name for stroke is called brain attack. It is actually an attack on your brain. When you have a stroke, what actually happens is that the oxygen and nutrients are cut off to your brain. And because of that, then, what we find happens is that the part of your brain can die. There's the different types of stroke. You have your ischemic strokes, which are a blockage. This is caused when there's a blockage in the blood vessel to the brain. A lot of times you'll find that this is caused, especially if you have like high cholesterol and some of that fatty deposit there will break off and will clog the artery. We also see this type happening a lot in patients who have atrial fib, which is a condition of the heart that seems to be a number one lead to this. Another type of stroke is a hemorrhagic stroke. This is caused by a burst or a leaking blood vessel in the brain. A lot of times, this is something you don't even realize that you may have as a weakening in the vessel. And these will cause bleeds into the brain. You also can have a subarachnoid hemorrhage, and with these, the ruptured vessel surrounds the brain. And these are a little more serious than some of the others that you may have. TIAs, we hear a lot about people who have mini strokes or TIAs. They are very serious. In fact, we're finding that about 40% of people who have TIAs are returning to the hospital and with that, and they're having strokes afterwards. So it is very important that if you are experiencing symptoms, that you do want to go to the hospital. Even if those disappear, you still need to go to the hospital and have a workup to determine what caused it to start with. Statistics. Every year, 795,000 people suffer from new or recurring strokes. It's a big number. Every 40 seconds, someone in the United States is going to suffer from stroke. Of all the strokes, 87 are ischemic, 10% are intracranial hemorrhage, and 3% are subarachnoid hemorrhages. And the ones that we really want to concentrate on are your ischemic ones, because those are the ones that can be reversed if you call 911 and get the attention quickly. We live in what is called the stroke belt of the United States. As you can see, there's a lot of southeastern or southern states there. We happen to be one of the eastern ones. This is pretty devastating if you think about the fact that we are one of the highest states, and we have 52.3 to 60.9 death rate per 100,000 population. And this is why strokes are a very big concern for us. Also, according to the American Heart, stroke will cost almost $68.9 billion in direct and indirect costs, and this was estimated for the year of 2009. Signs and symptoms of strokes. What are we looking for? If for some reason you would start to develop some numbness in your face, arms, or legs, sudden confusion, trouble speaking or understanding speech, sudden trouble seeing in one or both of your eyes, sudden trouble walking, dizziness, loss of balance and coordination, or sudden severe headache with no known cause, you need to call 911 immediately. The people who generally are the ones that recognize this are the people that are surrounding the people who are actually suffering from these symptoms. Don't let them talk you out of calling 911. There are many risk factors. We have the non-modifiable and modifiable ones. The non-modifiable ones are age. A stroke doubles for each decade of life after age of 55. Hereditary. You have a greater chance of having a stroke if a parent, grandparent, sister, or brother has had a stroke. Gender. Increased risk for males. Prior stroke or TIA. And then we have our modifiable risk factors such as hypertension, cigarette smoking, diabetes, other carotid or artery diseases, atrial fib, especially if a clot would break off and enter the bloodstream, heart disease, sickle cell disease, which occurs a lot in our African American population, hyperlipidemia or high cholesterol, poor diet, or inactivity or obesity. These are all things that if you have these risk factors, these are all things that you can help to control. Your hypertension, you need to make sure that you follow your physician's orders and take your blood pressure medications. Your cigarette smoking, stop smoking. Diabetes, make sure that you're watching your diet, controlling with your insulin. Your AFib, make sure that you're seeing a doctor. Hyperlipidemia, we have medications now that can help reduce your cholesterol. Make sure you eat a heart-healthy diet and exercise. They're told that if you exercise 30 minutes 3 times a week, then it will greatly reduce your risk of a stroke. Stroke prevention guidelines. Know your blood pressure. How many out there know what your blood pressure is? Have it checked annually. If it's elevated, work with your doctor to make sure you gain control. If you smoke, stop. Know your cholesterol number. If it's too high, work with your doctor. Control it. If you drink alcohol, drink in moderation. If you're diabetic, follow your doctor's recommendations. Carefully control that diet. If you have circulation problems, make sure you're working with your doctor to improve those circulations. Stroke is a brain attack, and it's often preventable. Remember the 3 R's of stroke and act quickly. Reduce your risk. Recognize a stroke. Respond immediately. Call 911. Learn these signs of a stroke. Face. Does your face look uneven? Ask the person beside you to smile. Arm. Does one arm drift down as you ask them to raise your arms out? Speech. Does your speech sound strange? Ask that person to repeat a simple phrase. For example, the sky is blue. Time. If you observe any of these signs, then it's time to call 911. Remember, time is brain cells. It's not nearly long enough, is it? I'm going to have to do it and slow it way down, Joe.
Was fun.